We'll be getting started in just a moment. Machika and colleagues at the secretariat, if you can just let me know when we're ready to go.
We are ready to go, Joanne.
Okay. Thank you.
104, all of us here.
Fantastic. Thanks very much, and good morning, good afternoon, good evening, and welcome to our 33rd board meeting and first virtual board meeting. I'm Joanne Carter. I'm the vice chair of the Stop TB Partnership, and I'm very honored and grateful that all of you were able to join us for this meeting. I want to start our meeting today by wishing all of you and your loved ones my personal best for your health and safety in these difficult times. We've all been impacted by the pandemic, and I know that many of you and your families and colleagues have faced serious illness and loss of loved ones due to COVID. So I want to express my profound gratitude again for all the efforts it took to be here virtually to continue this fight against TB. And we know that the impacts of this pandemic on health access, on economic security, and even economic survival are not shared equally. And it's the people and communities who are already on the edge, impoverished, who are marginalized and discriminated against, who face the most profound consequences with the fewest external resources. That is true of TB, and it's true with the impacts of COVID. And our response to both of these pandemics needs to be centered on greater equity and on supporting the communities and health workers who are the leaders in this fight to have the resources that they need to succeed. And I thank you all for being part of that. And we also know that the impacts of the COVID-19 pandemic have put massive strain on the progress we've made toward defeating TB. And again, many of you are on the front lines of this. And as many of you already know, the modeling work done by the Stop TB Partnership and other partner organizations have highlighted the really devastating impact that COVID has had on TB programs in countries. And many of you I know have been dealing with that day in and day out, and knowing that it's resulted in disrupting the gains we've made and has meant even greater suffering for millions of people not getting diagnosed and treated. So we have a huge amount of work to get back on track, but I think we all agree that getting back on track is not enough. And we need to build back with greater equity and more ambitious action and finding the synergies and the opportunities in this deeply challenging time. And I know, again, we will hear from many of you of the kind of leading edge work that you're doing in order to make that happen. This is a really important board meeting in tackling those issues of where we are in the TB targets, where we are in the needs of communities and civil society, where we are in the needs of financing, and the work that the partnership has done and that partners around the world are leading on. It's also an important board meeting where we'll be addressing other key issues, including also the independent review that's been in process of allegations of misconduct and racism at the partnership. And so we will have time both for the board itself and more in an executive session and more broadly to address those issues, present our findings, and also recommendations for some of the next steps. Which will be really important. I want to say that I am proud to be amongst you today and working alongside all of you and our partners to provide the necessary support to the Stop TB Partnership and in the work that has included, and that again we'll hear more about, rapidly highlighting the impact of COVID-19 on TB programs, working with countries to support and learn and collaborate with partners to develop measures to mitigate these issues. And just to say the positive impacts of the partnership would absolutely not have been possible without the hardworking commitment of all of you and the incredibly hardworking partnership secretariat. For this meeting today, I'd like to give some special thanks to the Ministry of Health of Nigeria and the government of the Federal Republic of Nigeria for their support of this board meeting, and also of the really important and exciting African Roundtable happening tomorrow morning with key ministers of health from across the continent. The Minister of Health and the First Lady could not join us today, but they will be addressing us tomorrow. So I'm very grateful and looking forward to that session. I'd also like to acknowledge the late Dr. Professor Lovett Lawson, former chair of the Stop TB Partnership in Nigeria, a passionate leader whom we lost to COVID this year. And as the board chair for Stop TB Nigeria, Professor Lawson led efforts for strategic engagement of many key stakeholders in the response, as well as planning for a number of high-level events in Nigeria, including this board meeting. For those of you who knew him well, he cared deeply, about the people under his care, and he worked tirelessly to make access to TB treatment available for all. So just to stop for a moment here in remembrance of Professor Lawson, but also the many lives we've lost this year to tuberculosis and to COVID, I want to ask Austin Obafina, the Executive Director of Afro Global Alliance, to lead us in a candle lighting ceremony. So Austin, if I can turn this over to you for a moment for a few words.
Thank you, Joanne. I will just
Austin, we can't hear you.
I'm lighting the candle
Thank you.
as our board meeting ritual, which was an initiative from the community delegation as approved by the board. So I'm lighting the candle in honor of people who have died of TB and people who are so affected of TB. Thank you.
Thank you, Austin. And thanks for that moment. And Austin, thank you for your leadership on the board and the executive committee and in the work that you do.
Thank you.
So now if I could welcome, I want to welcome all of you again, but I want to just welcome some leaders here. Our Honorable Chair, Dr. Luis Mandetta, who is joining us from Rio de Janeiro. We're so pleased to have you with us. Also really grateful to have other leaders, Dr. Harshvardhan, Minister of Health and Family Welfare of India. Your Excellency, welcome, thank you for being here. Also His Excellency Alexei Soy, the Minister of Healthcare for Kazakhstan. I'm not sure if I was able to see all the folks on here, but I know we will be having, if he hasn't joined yet, His Excellency Armindo Thiago, the Minister of Health of Mozambique, and also His Excellency Dr. Zweli Mkhize, the Minister of Health of South Africa, to his first meeting as a board member. I want to also congratulate in their new roles and welcoming to the board meeting Dr. Philippe Dunaton, Executive Director of UNITAID, and Dr. Mustafa Yidado from the Technical Agencies Constituency and the KNCB Tuberculosis Foundation Executive Director. And I'd also like to extend a special welcome to the Honorable Gerson Pereira, the Director of Diseases, Chronic Conditions, Sexually Transmitted Infections for the Ministry of Health of Brazil, to his first board meeting, joining us today to represent the ministry. And also really pleased to be joined by Dr. Shannon Hayter, who will be with us representing UNAIDS at the board meeting, and really grateful that you're able to be here. And then also special guests and observers, Nick Herbert, co-chair of the Global TB Caucus of Parliamentarians, and Mr. Arifin Panegoro, the chair of Stop TB Indonesia, who hosted us so well and has been doing so much leadership work on the issue of TB in Indonesia. So our opening session is going to start with a welcome from our board chair, Dr. Luis Mandetta, followed by an address by His Excellency Dr. Harsh Vardhan, Minister of Health and Family Welfare of India, and then His Excellency Mr. Alexei Soy, Minister of Health of Kazakhstan. After that, we're going to hear from Dr. Lachika Ditu, Executive Director of the partnership, who's going to present her report, and then after that, I will open the floor to the board for questions and comments before approving decision points for this opening session. And then we'll conclude with a short video and then awarding of the Kochan Prize and the Stop TB Community Award. So just quickly, since this is a virtual board meeting, before I turn to Dr. Mandetta, I just want to go through some of the housekeeping rules. So could someone project? Thanks very much. So just a few things to note. You'll be muted upon entering the meeting room. And if you can, keep yourself muted and your video function turned off. When you do come in, if you haven't done it yet, if you can rename yourself, make sure that your name is there correctly, so it will be easy to find you. And when invited to take the floor, if you could unmute and turn on your video and if possible, provide your full name. I would note that the board meeting is being recorded. And if you want to make an intervention, I know people are used to this now with Zoom, but just to say it again, if you could use your raise hand function, and I'll take, with the help of the secretary team, I'll take your questions in the order that the hands are raised on Zoom. And if for some reason you can't use the raise hand function or have a problem with that, please do use the chat box. And then when we get to decision points, I'll ask board members to use the yes/no function to approve or disapprove a motion. So now it's my honor to give the floor to our board chair, Dr. Mandetta.
No, good morning from São Paulo, not from Rio today, Joanne. I'm in São Paulo. I didn't get to Rio. Wish I was there. I'm very happy to see you all here in this virtual meeting, but I would be much more happy to be in close contact with you if we could. I just want to say to everybody that this year is beginning for the whole world a circle of science. So let's hope that our challenge to stop TB might get some light for us to face the real challenge that we have till 2030. I want to thank you, Joanne Carter, for her wonderful work that she has done since December. I remember the last time we were in Jakarta. I want to say and thank Minister of Nigeria, Osagi Eherniri, that in his name, thank for all the ministers of health. I heard from India, Kazakhstan, Mozambique, that is a Portuguese-speaking country, so please let me say, bom dia, meu caro amigo de Moçambique, South Africa, and all the countries that are joined with us today. And a special thanks to Lachika Ditu for the whole work that she has done, keeping me updated from all our challenges that we have for tuberculosis. I'll be with you all those 3 days in the morning, here in Brazil, in the evening, or in the night, all over the world. Thank you, Joanne. Thank you, the whole meeting, for being with us today.
Thank you, Dr. Mandetta, for being with us from Sao Paulo. And now I'm honored to welcome and give the floor to His Excellency Dr. Harsh Vardhan, the Minister of Health and Family Welfare of India, for a live address to the board. And just to say before we start, we remain enormously grateful for India's ambitious commitment and work toward ending TB by 2025. Thank you.
Excellencies, the Executive Director of the TB Partnership Board, representatives of the UN organizations, and all other esteemed dignitaries. Good morning, good afternoon, and good evening, all of you. Today, under the aegis of the Stop TB Partnership, we have come together at a most opportune time when we need to take urgent corrective action. When COVID-19 has turned the clock back by many years, if not decades, in the fight against infectious diseases. The deadly virus has derailed our painstaking efforts of many decades and diverted scientific attention from many infectious killer diseases like tuberculosis. The lockdowns have raised insurmountable barriers for patients, and people are still living in fear of the coronavirus. We all know that the last 10 months have seen treatment interruptions, hindered availability of drugs, shrinking supply of diagnostic tests, delays in diagnosis, interrupted supply chains, diversion of manufacturing capacity, and imposition of physical barriers for patients who must travel to distant clinics to pick up the medications. In such times of peril, the role of ethical organizations such as the Stop TB Partnership becomes even more crucial. Of course, Stop TB Partnership has always played a leading role in advocating for the adoption of best diagnostic and treatment modalities for tuberculosis. I understand that during the COVID era too, the Stop TB Partnership has not sat back. On the contrary, it has been proactively contacting countries regarding the implementation of their TB programs. India too had a meeting with the Stop TB leadership and discussed the ways in which we have been combating the dual crisis of TB and COVID and the way forward. On our part, the Government of India is targeting to achieve the Sustainable Development Goal target related to TB by 2025, 5 years ahead of the global target of 2030, and is implementing an ambitious national strategic plan in a mission mode. This ambitious program is being conducted on a war footing and is called TB Harega Desh Jeetega, which means TB shall lose and India shall win. During 2019, we had doubled and trebled our efforts on increasing tuberculosis notifications. I am happy to share that India has managed to close the gap in missing million TB cases. In 2019, 24.04 lakh cases were notified against the estimated 27 lakh TB cases. The number of missing TB cases was reduced to 2.9 lakh in 2019 as against more than 10 lakhs in 2017. The incidence of TB had also reduced from 211 per lakh in 2017 to 193 per lakh in 2019. However, like everywhere else in the world, the COVID-19 pandemic caused a major setback to India's efforts as well. During the period of January to October 2020, only 14.5 lakh TB cases have been notified, which is 29% lower than the same period in 2019, with the decline being over 35 to 40% in some states like Maharashtra, Tamil Nadu, Andhra Pradesh, Manipur, and Goa. The silver lining is that some states like Sikkim, Telangana, Haryana, Arunachal Pradesh, Kerala, Himachal Pradesh, and Odisha witnessed a less than 20% impact even during the lockdown period. These states strategized to integrate their TB case finding activities with COVID preventive measures. To mitigate the impact of COVID-19 pandemic, our health ministry has recommended bi-directional TB COVID screening among ILI and SARI cases, intensifying private sector engagement, redeployment of the repurposed HR and CBNAT and TrueNAT machines back to the TB program. With all these measures, TB services are gradually recovering. Health facilities are opening up, and more people are presenting themselves before the government and private health clinics to get tested. Case finding through outreach activities in the community have also picked up. With the gradual return of staff who had been diverted for COVID activities, public health action such as counseling, contact tracing, and disbursement of nutritional support are also picking up. We must look at the silver lining to this dark pandemic cloud. COVID-19 has provided us with an opportunity to boost TB elimination activities through health systems strengthening and infectious diseases control. Several dedicated infectious disease hospitals have come up as a part of the pandemic response measures, and these would undoubtedly contribute in a major way towards TB care and management. The molecular diagnostic capacity of the country has increased multifold. These multi-platform devices based on cartridge and chip-based technology can go a long way in decentralizing TB diagnosis. A renewed focus on infection control will alter transmission dynamics, particularly in health facilities. Behavioral changes acquired during the pandemic, such as cough hygiene, use of masks, physical distancing, will further help reduce the transmission of other respiratory illnesses such as tuberculosis. The increased uptake of telemedicine and teleconsultation during the pandemic will provide channels of consultation for tuberculosis. In such trying times, collaborations across all sectors would be essential to put up a strong fight against TB. And the Stop TB partnership, with the support of all of us board members, has a crucial role to play. I am confident that by sharing our challenges and experiences and by collaborating with each other and other sectors and agencies, our goal to see a TB-free world will be achieved. This is the time when the health leadership of the world must be able to drive government policy, raise investments in healthcare sector, and also raise the awareness of the general masses towards the loss of precious lives that is happening through uncontrolled infectious diseases like TB. The only way to win this war against tuberculosis is to fire the imagination of our people and make them realize how it is genuinely possible for them to bring their near and dear ones back from the jaws of death. I must state here with full conviction and might that TB elimination is not so difficult if we can create a mass movement against the disease. It needs strategized advocacy, thought leadership, and disruptive social entrepreneurship. It needs mass mobilization, aggressive campaigns, powerful partners, and deep commitments. And most of all, my friends, it needs a powerful societal and political commitment. TB elimination is one of the most important and arduous tasks of this millennium. The good news is that we are together and committed. With these words, I would like to thank you for the opportunity to place my thoughts before this learned forum.
Thank you so much. Thank you so much, Your Excellency. That was, thank you for the vision, but thank you for setting such an ambitious strategy as a model for the world and also for driving it forward, even in the face of all the challenges of COVID. And thank you for talking about how we use this moment, not just to recover, but to do better and smarter, and for the innovation at scale that you are helping lead around things like bidirectional testing. So wonderful way to open the meeting, and thank you for your leadership on this work. And now we're going to hear from the Honorable Alexei Soy, the Minister of Healthcare of Kazakhstan. Please go ahead.
Executive Director, Honorable Ministers, meeting participants, ladies and gentlemen. It's my great pleasure to address you at the 33rd board meeting of the Stop TB Partnership. I wish us all a successful meeting and constructive work today and tomorrow. The COVID-19 pandemic has demonstrated the critical importance of international cooperation, collaboration, and support in the fight against infection. The pandemic greatly impacted population lifestyle, countries' socio-economic development, and program implementation, including those aimed at combating socially significant diseases like tuberculosis. Countries globally demonstrate a decrease in the registration of new tuberculosis cases during the pandemic. This includes countries with a high burden of the disease. The access of medical services has decreased for people with suspected tuberculosis. Medical organizations and health professionals have been reoriented towards the provision of COVID-related services. Production and supply of drugs for treatment and reagents for diagnosing were interrupted. Provision of services to people from high-risk and hard-to-reach groups has decreased. We have clear goals of ending the TB epidemic by 2030, defined by the Sustainable Development Goal number 3 and the political declaration endorsed at the high-level meeting of the UN General Assembly on Tuberculosis Control on September 26, 2018, and the WHO strategy Stop Tuberculosis. It is important to note that Kazakhstan's achievement in countering the spread of tuberculosis became possible thanks to international partners' support, including the Global Fund over the entire partnership period. The Global Fund has provided Kazakhstan with 8 grants, including 4 grants for the tuberculosis. It is important to note that a significant decrease in the incidence and mortality of tuberculosis in Kazakhstan over the past 13 years is directly related to the Global Fund project's implementation. Every person with suspected tuberculosis, every patient with confirmed tuberculosis should not be left behind, be outside the scope of medical and social services. Only through joint efforts, we will be able to prevent an increase in the incidence of tuberculosis, which according to WHO will amount to 6.3 million cases of tuberculosis and 1.4 million deaths associated with the impact of COVID-19 in the period from 2020 to 2025. Only through joint efforts can the countries of the world ensure further progress in eliminating tuberculosis as a public disease. I wish the Stop TB Board fruitful work and productive solution for the benefit of everyone's health. Thank you for attention.
Thank you, Your Excellency, for those words and for the leadership that you provide in your country and the region, and really grateful to have you with us today. Thank you. We're now going to hear from Dr. Lachika Ditu, the Executive Director of the Stop TB Partnership, on her report on the achievements of the Secretariat in 2020. Before I give the floor to Lachika, I do want to say on behalf of the board how much I'd like to thank the incredibly hardworking staff of the Secretariat for their intensive efforts and for the leadership they've shown, again, in highlighting and working to mitigate the effects of COVID on TB programs, all of the dedication, effectiveness, commitment to supporting the efforts and leadership of countries and the leadership of affected communities and civil society in the fight against TB in this really challenging year. So to hear more on their work and plans going forward, I'm now really glad to turn things over to Luchika, and we will after that take comments and questions from the board. So thank you, Luchika, and please over to you.
So thank you very much, Joanne, for the introduction. And I want to start by saying that it is indeed a challenge. It's always difficult to do these virtual meetings. I think we are so much used to be together, but our lives are changed. But I'm extremely impressed by the fact that we are an incredible large number here. Everyone took the time to be together. And also I want to really thank from deep from my heart for all the colleagues from the affected community, civil society, and TB survivors that are here online with us, as well as our fantastic ministers of health. Thank you so much, Excellency Vardhan, Alexei Toy, but also thank you so much, Minister of Health of Mozambique, and for being with us. It gives an amazing hope, seeing that your commitment to continue our fight on TB in these very difficult times. So I will go in this sort of 15 minutes presentation that I have, trying to emphasize a bit of our work, speaking on 4 buckets of points, 1 on tuberculosis, 1 on COVID, 1 on people, and I will leave at the end some good news that I want to share with you. What you see on your screens projecting by the team here is actually the format of our new board report. We had to change all our lives. We all sit in our offices or wherever we are now speaking to a screen. I think if somebody comes in and looks at what we do, somebody from another planet will be a bit surprised to see how we spend hours looking at the screen and speaking in it. Anyway, we had to move our report, and it's a virtual one now. I hope you will like it. I want to thank our young and very energetic designer, Nina, who really managed to get this platform and also to make this nice, beautiful report. And I want to advise all of you, if you don't have a designer, you should have one in-house because it's amazing. And I will not go over, you can see that the format is really nice, but also it's easy to navigate, it's easy to read it, even when once you download it, there is no internet connection, and it has a lot of links to photos and movies and links to other pages, the videos that can be easily seen. So as I said, the first part that I want to speak about is related to basically TB. In this board meeting, as you, Joanne, emphasized, is an important one. We are at the end of 2020, not only challenging and so different than all the others because of COVID, but also challenging and different for all the others because it's the year midway for the UNHLM timeframe. So we have 2 years that passed and we have 2 more years to go, 21 and 22. And in this board, we will hear about the targets and where we are. We will hear about the financing and where we are. And we will hear about the efforts that we need to do going forward. 2021 will not be an easy year because we will continue being impacted by COVID, but also we must jump back to try and see if we can reach where we were supposed to be in 2021. And our level of starting the jumping is not as it was supposed to be, if we didn't have the COVID. As the ministers outlined, we had impact because of COVID. So the level where we start trying to pick up is far behind. So that combined with the fact that, we have the pressure of the targets on one hand, we have the pressure of limited resources on the other hand, and we have the pressure of a pretty fragile and changing environment, social, economic, and political. As you can see, wherever you turn in each continent, there are turmoils, changes in the political powers, in the agendas, economical changes, impact will grow further. So we have to navigate a lot with our TB movement, that it's not necessarily the biggest, but I would say it's growing significantly. As Stop TB Partnership in 2020, we continued as the ministers. My colleagues here are just projecting their emails, which I think is very entertaining, but maybe they switch that off. As Stop TB Partnership Secretariat, we were doing a lot of efforts this year to continue our work. And I have to say that, as you will read, amazingly, and in a way, unless for people that will just hear that, difficult to comprehend, actually, most of our teams delivered the most in 2020 versus the other years. Believe it or not, and you will hear from GDF, you will hear from TB Reach, you will hear from our colleagues from Community Rights and Genders and Country Support. We did, you will hear for everyone in advocacy and comms, in this year, we managed to overpass the work of last year's. And grants were not stopped and the work continued. There was no interruption on the funding going from TB Reach or Challenge Facility to the ground. There was no stock out from the GDF work registered in terms of diagnostics or drugs. There was an incredible amount of support to countries applying for the Global Fund funding. There was a lot of support to our partners on the ground in pushing forward the agenda on community rights and gender, with some spectacular work that the partners did, supported by us, but mainly by themselves, in terms of the visibility of our communities movement globally. We actually also, as a Stop TB Partnership, got a lot of visibility in media, and we managed to have some events that were extremely well attended. You will see that the number of social media presence, quotes in newspapers and everything, it's extremely high and remarkable for this year. We will hear more from the other teams in terms of also the fact that we as Stop TB really pushed forward a lot on the agenda of artificial intelligence using digital technology, and also contributed a lot to a lot of the thinking around what Minister of India spoke about, the bi-directional testing for TB and COVID. So that was, that's about, I will not enter into the specific things that we did, as there will be sessions unpacking all these pieces. I want to say, to go to my second point, which is related to COVID. And I want to say for COVID specifically, three things. First is impact of COVID on staff. We in Stop TB, I am extremely proud and honored of how we worked this year, because we managed to follow incredibly well the rules, the regulations of UN, first of all, of Swiss authorities and of the Global Health Campus. We were at the forefront of discussion, the need for airborne control, infection control measures. We pushed about the mask in the conversations with everyone, but most and foremost, our staff was very safe, even though we also had a lot of flexibilities in allowing staff to take the time to be home or to come to work as rules were saying. We basically have one staff member through all this period that had COVID. And we think this is remarkable. And here in Geneva, we have a lot of other organizations with increased numbers versus what we have. So the impact of COVID on staff life was big because we all experience being in virtual mode and so on. But as I said, our health as well as our work, it was not impacted. Not only that we managed to deliver from Stop TB Partnership what was expected for this year, our KPIs are standing for this as well as the work, but we actually, for an organization with our funding, we tried and did our best to help also in terms of COVID by supporting in either deploying some of the cartridges, some of the PPE, but also through TB Reach and Challenge Facility, allowing or supporting some of the grantees to really use these funds to ensure that they are able to continue their work, but also address some immediate needs for COVID. And some stories I can tell you were heartbreaking, because initially in the beginning of the pandemic, for our little funding was sometimes extremely well received by the countries. So on the COVID, the third point, beyond the impact on staff and the fact that it really had almost no impact on our staff in terms of numbers sick, almost no impact on our work. The third point that I want to make on COVID is, what we learned from COVID. And I want to say that in the fight against COVID, actually, people fighting for it used a lot what was learned from TB. And we have a lot of our TB doctors, nurses that became from TB managers, COVID managers, or COVID and TB managers. So there was a lot to learn from that. There was a lot that was used on the COVID fight in terms of the active case finding that we do, contact tracing, infection control, as I said, use of the mask, the hospitals and the dispensaries with a very good circuits to avoid infection control, diagnosis tools. The way in which the communities are so resilient in TB, I think it helps a lot to address that and to understand that in COVID as well. So I think that actually the COVID movement had a lot to take from TB. But what I think from TB, what we learned two things from COVID. One is on a personal level, and it is related to how fragile we as humans are, and in face of such a situation, and how much our lives can be turned upside down in a flip of a coin, and becoming extremely vulnerable if we are not able and we are not prepared. And I think a lot of lives of our friends and families, our own lives, were really heavily impacted by this COVID. But we learned on equally with the fragility, we learned also the resilience. We learned that we can carry a lot if we are really committed and we want to do it. So that's what I think COVID gave us on a personal note. On a work level, I think what COVID learned us is that actually all the things that we want in TB, that we put at the level of aspiration, are feasible. When we speak about, we need funding, actually COVID showed that it's possible to mobilize huge amount of funding in a short amount of time. We in TB dream for having new tools and the vaccine, I think we will retire, some of us, before we will see a vaccine coming out. And we see that it is possible that the world can get mobilized and have a vaccine amazing in less than 10 months. And that our horizons, and I know that Dave Levinson will tell us, our horizons are, if we are lucky, by 2027, we might be able to see a vaccine, okay? The way in which the world that was able to get united and to collaborate to address COVID, that's another thing that we were able to see, and we were dreaming for TB as well. And Honorable Minister Vardhan spoke about, aggressive campaigns, deep commitments, and mass movements. We speak about wearing a mask since always, okay? And we are now impressed how quickly this took off now because of the COVID. It also shows, how the world is getting mobilized, and the things that can be done when people come together around a pandemic as such as COVID, also triggered by the fact that there are live data that are channeled through us. We are bombed with information on how many people with COVID are every day, by gender, by city, by neighborhood, by age groups. With TB, we don't have this. If it was a screen on television that would have said how many people die with TB every day and how many die with COVID in many countries, that will be terrifying. And, we have 700 children with TB dying every day. Children with TB. Leave aside the 4,000 overall, so with adults included. So COVID learned that that's possible. And a lot of countries that are actually having difficulties with the data for TB or other diseases actually mobilized and made the live data available. And I really hope that the Indian model, which is actually unique in the TB world, in having live data for TB, will become the norm for all the other countries. So COVID learned us it's possible. Why it was not possible for TB till now? I think this is very much linked to something that our colleagues from Community Rights and Gender will speak about, is the deadly divide. The deadly divide between the type of people and the people that are suffering because of TB or dying because of TB, and the majority of those that are suffering and dying because of COVID. For a long time, as you know, in TB, there were double standards, and people in countries with low income were having a certain type of guidance for tuberculosis versus the countries with a high income. So the discussion about getting into the social justice and looking what a deadly divide means between promises and what's happening, but more important, between why it's possible for a certain disease, why it's possible for certain groups, and why it's not possible for other groups. I think if we take this head on, I think we will be able to get some very good answers for tuberculosis. The next point that I want to make very briefly, it's related to the people. This is my third area of this report. Beyond any paragraph that you see there, any text, is a work of a lot of colleagues here, a lot of stress, a lot of phone calls, a lot of emotions, a lot of happiness as well. So it will be really great if you have a chance to read it, because I'm really grateful for every single one of them. We managed this year to maintain the work that we were doing. We I was laughing the other day because the head of an organization here in Geneva said, we did great this year. We managed to have 5 all-staff meetings. I said, we had 42. Every single Monday this year, with maybe 2 or 3 exceptions, we managed to have an all-staff meeting for 1 hour. And we managed to have also on every Tuesday an executive team meeting as well. And on top of that, people discussed as well in their teams, and I also managed to have discussions every other week with different teams to understand not only where the work it is, but also how much we can stay in touch and what is affecting our work and our achievements. And I will say a little bit something more tomorrow. But in the people group, the staff of Stop TB is one group. The most important staff, the second important staff are the technical people, the ones that the partners, actually all of you, that we all managed to stay together and deliver this year. And we are extremely grateful for the efforts, but also the risks that most of the colleagues that are on the call here and that are on the field are facing every day in addressing TB and COVID. Just the other day, our colleague Ivan Solovic from Slovakia was appointed to be the COVID head. And you can imagine the pressure that he's under it. And it was very interesting to have this discussion. And I know there are many people like him in the same situation in other parts, in all the parts of the world. And the most important group of people that I want to refer are people that are affected by TB, people suffering because of TB and COVID. I am extremely pleased that our colleagues from the civil society constituency and communities are able to join us here. And I am extremely pleased that we are able to get their inputs and their meaningful engagement, because they represent the voices of the millions that are there and that we are supposed to serve. We are not here because we just to find ourselves in business. And I'm grateful for the staff of Stop TB who in the staff survey showed so strong commitment to our mandate and the solidarity of staying together and going forward in our role to really support everyone that is battling TB and COVID. So the last point that I want to make, I said I will have 4 good news. The first good news is that we are proposing a World TB Day theme, and I want Stefano to project, and this will we will see if you are what will be your feedback to this theme. We have a little slide to see, and you can see the proposal here on the clock is ticking. As you can see, is building on the previous campaign. And we think it's pretty flexible in adjusting it to mobilize all of us there around it. But also, we hope it gives a sense of urgency because we need to have this sense of urgency with us. unless we are doing some amazing work in 2021, we will not be able, 2021 will be crucial. If we lose 2021, we will not be able to reach the 2022 UNHLM targets. I am extremely impressed by the ministers of health, starting with India, Kazakhstan, and the others, Nigeria, Mozambique, that are here with us, and the commitment to go ahead. But these are a handful of countries, and we have a large number of countries. So we need to see the same pressure of bouncing back of where we are supposed to be after we, in 2021. If we don't gain what we lost in 2021, we will not be on track. So this is the proposal. There will be some discussions and consultations on this theme. So this is my first good news. The second good news is related to the fact that if you know, we are trying hard to ensure that we expand our donor base as Stop TB Partnership. And we are very grateful for going beyond some of our traditional donors that unfortunately for years abandoned us, to say so. But we are very happy that we started a great collaboration with the Japan government, and we are very, very thankful for their support. You will see around the board this time our Hello Kitty campaign to really, put more light on children with TB and drug-resistant TB, but also to put more light on the fact that with the support of the Japan government, we are able to support grants to countries for children with specific formulations for drug-resistant TB, and you will hear about that a bit longer. So, but now I want to say that beyond the Japanese government, we are extremely grateful that KOICA, representing the Korean government, and I'm very grateful for the permanent mission of Korea being with us today, are very supportive of us. And we just received a letter of, I don't want to, it's very strong saying commitment, but it's actually putting in writing that the intention of supporting Stop TB Partnership work starting with next year. And I'm extremely grateful to have our partners from Korea, with whom we work amazingly well, supporting us, especially in an amazing area of work, which is really supporting, which we already started, which is developing new startups, supporting new startups and new companies from the developing countries to really get their products and bring them up to the level of being considered as tools and being recommended by WHO. So thank you, Korean government, for that. I left the ones that are closer to my heart, sorry for the previous ones, the closest to the last are related to securing funding for our work on community rights and gender. And I'm very proud of the work that we as Stop TB did over years and where we are right now. We are in a completely different place. We have constituencies, we have networks at global, regional, and country level. We are able to mobilize voices of support of our movement, and this is fantastic. We are able today to support, we will discuss more in a CRG session, but we will have a challenge facility for civil society round 10 that will be launched in January 2021. But we know already that we will have it at a level of around $7.5 million. This is the highest ever round that we have for challenge facility, 3 times more than the round that we announced in Jakarta last year. And this is remarkable. And I really want to thank USAID and Global Fund for the support. And the second piece that is related is that finally, we are able to announce that we will support the constituency of communities and civil societies to get the contribution and the engagement with the board, and to ensure that the governance part is covered for the following 2 years at the level of 300,000, being really nicely supported by 2 great donors of our board. These are my 4 important news that I wanted to end in a very high note. I think we are very grateful, all of us in the Stop TB Partnership Secretariat, to be able to work for you and for especially the people that we serve in the field. We have a business to finish, and we are not yet on track to finish it, and we will have to continue doing this work here with full respect for everybody, for ourselves, and for the world. I want to see if Adrian Thomas, who is from private sector constituency, want to say something around the support for the civil society here or not. But for me, I finished with my report, and thank you.
Thanks, Lachika. Look, I would like to say a few words. And this topic was first raised at the board meeting last year in Jakarta, and we were very supportive of this from a private sector perspective. And I want to thank you for the opportunity to comment today. We're one of the donors in support of the effectiveness of our colleagues from the civil society affected communities on the board. I can personally attest, this is now entering my second term representing the PSC, how important it is to have the support necessary to be effective at the board level and what it takes. I'm very, very grateful for the constituency companies that I represent for that support and the hard work that they and the Secretariat put in, because it's by no means a part-time job, as we all know. At the end of the day, we're all here to try and address the common mission of addressing the burden, the suffering, the risk of infection, the economic crisis that TB represents in the world. And nothing is more, I think, emblematic of that than the work that the affected community board members and civil society board members do in representing their constituencies and those perspectives. I want to finish by really thanking them for all that they do in representing their communities, for their passion, for their commitment, and by reaffirming the private sector constituencies' commitment to TB. Many of our membership are actively involved in addressing the COVID challenge we have today, including my company, and I can put my hand on my heart and tell you that we are actively advocating for ensuring we continue to focus and gain traction coming out of this crisis on the challenge that will still be here tomorrow and the next day and the next day with TB, and the need to work much more effectively. And one of the things I also want to thank the board for is the willingness to allow and welcome the private sector contribution. So I'll finish with that, but again, my congratulations to the work every day of board members representing affected communities, and how pleased we are to be able to provide this small contribution as one of the donors and make sure that we're as effective as we all can be. So thank you, Lachika.
Thanks very much, Adrian, for your support in the private sector constituency, support for this critical work of affected communities and civil society and more broadly. And back to you, Lachika, thank you and the whole...
There are some people that are still joining, but I think we have...
sorry. And Lachika, just again, a thank you to you and the whole Secretariat team for the not only incredibly hard, but also effective work that you pointed to and talked about. So before we move to a few brief interventions from the board, we'll see if there's that. I want to just take a moment and recognize Moin Karim, the Regional Director for UN Ops in Geneva, and give him a few moments to speak to the board. And just in advance saying a huge thank you again to Moin and to Michael Berholt for the support to the partnership, for the work that we've done together with the board and the executive committee. So Moin, thank you for the support for the partnership, and over to you for a few brief comments.
Thank you, Vice Chair. And I will be brief. The UNOP statement we have also shared in the Dropbox. So I will just address a few points. So thank you again, Chair. Thank you, Madam Vice Chair, Honorable Ministers, esteemed board members and colleagues. As I address you today, I can proudly say that we are commemorating the beginning of the 6th year of Stop TB UNOPS partnership, a partnership that UNOPS is extremely proud of. The hosting relationship has progressively evolved since the beginning, and we proudly continue to provide an efficient and robust platform for the important cause of fighting the scourge of TB. As you all are aware, we are marking an unprecedented global pandemic this year that has affected our way of living and working. It has tested our resilience and ability to continue to do our work. Despite these challenges, Stop TB Secretariat, together with the UNOPS team, has delivered solid results and services than ever before, especially to those that are in need for the Stop TB partnership and beyond. I just want to highlight one or two quick elements. These timely services and day-to-day services were approved last year for an annual budget of 96 million. While we witnessed a reduction in normal events, meetings and travel, there was a higher demand when it comes to procurement and grants, and taken together, we expect to deliver about $100 million this year. This is remarkable considering the pandemic that we are facing since March this year. Very briefly, as you know, the Secretariat has 84 members, and I'm proud to say 63% are female, which is quite one of the highest numbers in any of our programs. And we have 254 active human resource contracts around the globe. The grant-making modality also remains in high demand, with over 200 new grants and amendments this year. Very briefly, also I want to mention the financial oversight and management remains robust, and close to 100 financial reports were issued this year. We will address all these elements in our report, but I just want to thank very much the Vice Chair and the Executive Committee, because we have worked very meticulously together in response to the follow-up to the news report, through independent assessment, as well as fortifying the utilization of UNOPS internal systems and procedures. Finally, regarding the transition to a new host, you will recall the statement at the last board meeting, where we discussed the planned departure of Stop TB Secretariat from UNOPS in June 2021. Subsequently, UNOPS senior leadership has endorsed the request from Stop TB Executive Committee of flexible arrangements, if needed, beyond June 2021 until 31st of December 2021, to allow for additional time to complete the operational transition as necessary. In that light, we have agreed also to host a joint workshop with the executive team in March 2021 to draw up the necessary timelines and transition arrangements. With that, I would like to reiterate UNOPS's commitment to an orderly transition of the Secretariat to a new host, and my team in Geneva will continue to provide full support to the Executive Committee and the Secretariat to implement and adjust the transition plan as needed. Thank you again, Chair, and thank you again, Vice Chair and honorable colleagues, and I remain at your disposal for any clarifications as needed, and I wish you a very fruitful board meeting. Thank you.
Thanks very much. Thanks very much, Moin. And again, thank you to you and your team for the partnership and support, and including the support, as you pointed out, around future hosting and the rest. So very grateful for that partnership. So we are a little bit behind time, but I do want to take a moment and see if we have some comments, any comments, questions to start. So we'll take some briefly in this moment from Luchika's presentation. If you would like to make a comment, if you could raise your hand, and I will take those, try to take those in order. I see Timur, and if you could just maybe when you make your first intervention, if you could just introduce yourself again. So Timur first, please.
Yes, thank you very much, dear board members, dear guests, dear representatives of Secretariat. Basically, I just want to say a few words of thanks. First of all, to the Executive Director and the entire Secretariat for continuously working in spite of all the challenges 2020 has been a historic year. It's amazing that actually you guys are able to achieve so much. And I feel a bit concerned that you keep on raising the bar. Sometimes it's scary, like when we see a blockbuster and we think about a sequel. The sequel is hardly as good as the part before. So you have done so far amazing job, and I really hope you will continue doing that. I also want to thank the donors, the two donors who are providing support to the 3 civil society delegations. And I can promise you that this money will help us be as engaged and also frustrate you sometimes by how engaged we are, and by actually honestly and effectively representing our communities, our constituencies. So thank you for that. And I also know that my fellow board member Toko will say something as well. Thank you very much.
Thanks. Thank you, Timur, and echoing your thanks to the donors for this incredibly important support that is really, again, the core and the leading edge of our work. Next, Sherry Vincent.
I think Toko was next.
Oh, sorry, I'm just going with where I see the hands up. Toko, please, go ahead.
Thank you so much. Good morning, good afternoon, everyone, from wherever we are. It's good to see the familiar faces again in this year. So just reiterating what Timur has mentioned as regards to the developments and the successes that we have made in the year 2020 as a partnership, really first of all is to appreciate the effort of the Secretariat and of course all of us as board members who have contributed to these massive successes. It hasn't been easy. And being someone who's working at a country level to see the on-the-ground challenges as regards to the impact of COVID and TV programming, I really have no words to mention, but right to say this has been amazing. First of all, secondly, I also wanted to mention the issue of the increase in resources. I think in the past board meetings, this has been one of the issues that came up, and to see ourselves moving beyond an issue to actually look at the success. I think this is something remarkable. And especially also just retaliating what Timur has mentioned in appreciating the new donors who have come on board. Yes, thank you so much, and we look forward to your continued support and partnership as we move forward. I wanted to also recognize the issue around, that Luchika mentioned around building sustainable networks around TV, which has been one of the biggest successes, and particularly to mention our successes as regards to adopting issues around gender and human rights in TV. And now just also mention that we have finally launched a new critical partner, which is TV Women, which is advancing gender issues, which is beyond the progress that we had made as regards to rolling out gender assessments, CRG assessments within countries. This is really remarkable, and we need to put it up on our radar as something that has really been achieved this year. And again, also just to mention that we still have issues around UN high-level meeting on TV in terms of advancing social monitoring on issues of community-led monitoring. This is one other issue that we need to take forward as we move to 2021. And also just to mention that reading through the reports, we have seen significant effort within the partnership on adopting these new innovative social accountability processes to ensure that we indeed moving towards attaining the UN high-level meeting agreements. So with that said, I wish to submit and thank you, Chair and Vice Chair, for your leadership as well to get to this point.
Thank you, Toko, and for your leadership and others on TV Women, and also the point you make about the incredible importance of this community led monitoring that we've seen emerging from the Global Fund and also supported importantly through Stop TB and the work of you and others communities. To Sherry Vincent next.
Thank you. Sherry Vincent from USAID. Good morning, good afternoon, everyone. I first want to thank the ministers that spoke today, in particular the Minister of Health in India. You give us confidence, you give us hope that actually we can reach our targets. Your leadership is inspiring. The work that your country is doing is inspiring on the fight against TB, and I thank you for that effort. It really is important to all of us and inspires all of us of what can be done. So I next want to thank Luchika's leadership, but also the whole entire partnership. We know it's been a difficult year. It has been challenging, and it's amazing what has been done. I look at the reports that keep on coming. I look at the website. It is a reference, the website, for all of us looking at TB and COVID. There's a lot of data on there, a lot of information. It keeps on improving, and it's a resource that I refer people to all the time. So I think, all the work that you've done, but in particular, the work on CRG and empowering communities. It's not about just doing assessments. It's about empowerment, it's about engagement, it's about leadership. And the approach that you all are leading on, which is really being led by the partnership in TB in this area, is also inspiring. It starts from the bottom, and as we see from the top in India, and we need everyone engaged. So I really think it's really motivating to see that. I also want to thank the new donors that have come on board. To the government of Japan, the Hello Kitty campaign is amazing. I'm really excited to see that rolled out. I think that will be something that will really touch families and communities. So look forward to working with all of you on that and at the country level, and to the government of South Korea on new innovations. We need new tools. That's one of our biggest barriers. So you're focusing on an area that really is critical for TB. And then to congratulate GDF. I mean, who could say that in a time of COVID, we wouldn't have any stockouts? That is an amazing feat. That is something that is so incredible. We didn't even have to worry about it. We had colleagues in the USG, saying, okay, we're worried about this product or that product. And I was able to say each time when I reported back, GDF has this handled. Not that it was easy. They had to split orders. There were additional costs for delivery. There were supply chain issues within countries. But the fact that they were able to service countries and work with countries to help across the globe is really something to be proud of. And then last, I want to say to all of our country colleagues that work in TB, you are the unsung heroes. TB colleagues were called upon in countries to address COVID. The work that was been done on TB was used as platforms for infection control, for contact investigation, for diagnosis, supply chain systems. There were lots of things that, MDR wards. So there were lots of platforms that were built while saving lives for TB that could be used for COVID. And I think we need to remember that. It's happened before for avian influenza, it's happened for Ebola, and now we see it with COVID. So it's just showing that this is a good investment. It's an important investment. You can cure people, you can save lives, and build the platforms that are required to strengthen health systems. So I congratulate all of you, and I look forward to the next few days. Thank you very much.
Thanks so much, Sherry, for those important points. Next, Austin, please.
Thank you, Joanne. And thank you, Luchika, the Executive Director. It's always a pleasure listening to you. I mean, every year every board meeting, there's something innovative that it comes out with, and the report is just quite on point in terms of with all the challenges that we have experienced this year with COVID, and we still see such a tremendous results coming from the Secretariat. Thank you to the Secretariat as well. At least I've had the opportunity of working with a few of your staff in making sure that we keep the momentum still going. And it's been a wonderful opportunity having such an incredible staff who are so dedicated to move things, even in spite of our horrible delays sometimes from this part of the world. But thank you so much. And also on the work of the CRG, I mean, it's good to hear this all the time in terms of the results coming out from it, thanks to the partnership and also the partners who are also engaged in helping to make sure that we achieve all these milestones. I also want to thank the private sector and also the new donors who are coming on board, especially supporting the delegations, the civil society, the 3 civil society delegations on the Stop TB board. It's something that we've always been, crying out for, to make sure that we strengthen our governance system to enable our transition and also enable us to work better, and also help to influence certain decisions on the board. We are so grateful. We are very happy about some of these interventions that is coming out from the partnership, especially with the challenge facility that the USAID and the Global Fund are supporting. Have seen a very strong support, campaign coming from the African region, and also becoming a very strong global event. The TV33 campaign, challenging the Global Fund to actually increase the disease split. So we are so grateful to the Secretariat and their work, and also grateful to the EC and all the board members for their strategic decisions, supporting the partnership to move forward. Thank you very much.
Thank you, Austin, for your leadership as well. Pierre Blaise next.
Hello. I will not repeat what I just heard, but good morning, good evening, good afternoon to everyone. Pierre Blaise from Global Affairs Canada. First of all, it's eliminating tuberculosis is as important as ever. This 2020 year was very challenging. So I just wanted, without repeating what Austin has just said and what Sherry has just said, just wanted to really thank and recognize the hard work of the whole global TB community, in particular the Stop TB Partnership Secretariat, its board, its members, and of course the civil society. We really appreciated all the contributions of civil society in the past couple of years, especially since the HLM. We look forward to working with all of you in the coming year. Thank you very much.
Thank you, Pierre. I don't see other hands up at this point. Thank you for those initial interventions, and also just reiterating, despite the huge challenges of this moment, I'm really inspiring to hear both, the ambition that still exists, and that we have to drive forward the progress on support for civil society and communities, which again needs to just be a start for building out that work further, and all the leadership of countries and of the partnership of the Secretariat. So just a little bit of business that we need to do to kind of kick off the board meeting officially as well. Can the Secretariat bring up the decision point just for this first session? Thank you. And again, apologies that we weren't able to share this in advance, but it is essentially approving the agenda for the board meeting, action points from the last board meeting, and the report of the executive director. Do we want, I probably would need glasses to do this. Do we want someone from the Secretariat to just quickly read the decision point, just because we haven't shared it in advance? Perhaps somebody could just read that. Yeah, if somebody can unmute, just so people hear it.
Maybe my colleagues are having difficulties. I don't know, Jennifer?
Okay.
Okay.
Yeah, Timur says he could read it as well. Timur, do you mind doing that? We can do it quickly, but just because it hasn't been shared in advance.
Yes. So decision point 33.1. First, the board adopts the oops. Now I don't have it on the screen. Thank you. It's easier to read it when it's on the screen. Yeah. The board adopts the proposed agenda for the 33rd Stop TB Partnership Board meeting. The board notes the progress and appreciates the Secretariat for addressing the decision points from the 32nd Stop TB Partnership Board meeting. The board welcomes the Executive Director report and thanks the Executive Director and the Secretariat team for their excellent work done in 2020, especially for delivering during the special situations due to the COVID-19 pandemic. The board applauds the announcement of 2 years of funding to support 3 Stop TB Partnership Board constituencies: affected communities, developing country NGO, developed country NGO. The funding will support proper governance practices, including accountability, meaningful engagement, coordination, contribution, alignment, communication, and participation of the TB-affected communities and civil society in the Stop TB Partnership Board and other global TB-related fora, mechanisms, and initiatives. The board commends the 2 donors for this outstanding commitment. The board applauds the announcement of round 10 of the Challenge Facility for Civil Society, with a tripling of the budget to $7.5 million in response to the increased demand for support from grassroots, community-based, and civil society organizations. This expanded level of funding is particularly critical now, when the COVID-19 pandemic has negatively affected grassroots partners in their efforts to address TB. The board appreciates the financial support of USAID and the Global Fund and encourages additional donors to consider funding for this unique multi-donor funding mechanism. The board notes the 2019 Key Performance Indicators final report and the intermediary process in achieving the key performance indicators for 2020. Looking forward to its final report at the 34th board meeting. I think this is...
Perfect. Yeah. Thank you very much, Timur, and very appropriate to have you reading it. So can I have a motion for approval of that decision point? If someone could just raise their hand. Thank you, Miriam Schneidman. And a second, Toko, thank you very much. Any questions or comments? All in favor, if you could use the yes function. There's you have a green check for yes.
Sorry, I do have a comment.
Oh, go ahead. I'm sorry. Go ahead, Timur.
Yes, so basically in point 4, it would be nice to actually say who are the donors supporting the 3 civil society constituencies. We are mentioning the Global Fund and USAID further on when we speak about the Challenge Facility, but in point 4, the constituency funding, I guess the donors have to be acknowledged.
Yeah, thanks. Can we, if we can add those, I think we could probably move forward and add those into the final decision point, but fully agree and suggested that as well. So thank you. And it may be easier to just say, any other comments? Sorry, thanks, Timur. I think that is important. Okay, then if folks can use, so it's the yes button just to approve the decision point. So it's the little green check mark, yes. All those in favor? If you can do that, or it may be easier to say any opposed. and that would be the red X in your Zoom function. We'll give it a moment, and if seeing no opposition or abstentions. Thank you very much, Minister. Thank you. Yeah, go ahead. Timur, did you have a comment? No, oh, you're.
Yes, I see the red X from David.
Sorry, that's a mistake. I thought, was anyone opposed? I'm not opposed.
Okay, thanks. All right, I see lots of check marks and and no opposition. So I would say that decision point is approved, and we can move forward. And the next section of this, I'll be turning it over to Luchika to start us off on I think an inspiring awards ceremony.
Yes, so thank you so much, Joanne, and really thank you for all of you for the nice words, and thank you, UNOPS, being with us for all the challenges we went through and we are still going through together. And I want to just say thank you for the kind words. It was amazing, and I know some of my team is online, so it's really great that they have an opportunity to hear you all, and Your Excellency Haj Vardhan also to inspire all of us to keep going. The next session is a ceremony. It's really recognizing some amazing work done by some amazing people. But this year, the theme was related to nurses and of Kochon Prize, because it's about Kochon Prize. And I would like to start for all of us to have a little video that is really remarkable in bringing to us the work that, no, actually, it will be good if we have the video of the nurses for my team before the video of Chairman Kim, please. And that is what we have now, a 3 minutes little video about nurses that we think is extremely inspiring.
I became a nurse. One, I admired how nurses were. I feel I am called. I have a passion for people. I just imagine I've not come. How many lives could have died? How many people could have suffered? And what will I tell God when I meet him one day? Yes.
When my mother was not well, I went to the hospital and saw what the nurses were doing. I got passion to become a nurse. The nurses do a lot of work here. One, they do TB screening. Two, they do TB education. Three, they are able to take off samples and send to the lab for TB diagnosis. Then they enroll these patients who have turned TB positive onto anti-TB therapy. They do group counseling.
Abasawo bannansi engeri gye banyamba kubanga nali mu mbeera embi nga seewulira bulungi naye bambeererawo bangumya ne bangamba nja kuwona ne nkola ekyo kye baagala ne babeera mikwano gyange.
Người lục bì nên trâu miên ca thẹt toam ở bàn trầm trâu nâng đôi xa ấy ở đền tu nè tì nhom nâng vì miền ở bên chừng người chu nâng á đầm bây giờ đẹp lục hữu tha lục ru chừng người lấy quạt chu mà mày chẳng lục hữu bình định ở quạt hòn chẳng
Bà sanh nói chị kiên lục ru tết chơi phim tê nhưng bà hai chị là ai rồi ở thằng này tê.
Vậy đây chúng tôi ở nhómធ្វើការងារនេះជារៀងរាល់ថ្ងៃទី1ការងារដែលខ្ញុំធ្វើនេះគឺជាចំណង់ចំណូលចិត្តរបស់ខ្ញុំហើយការងារនេះគឺខ្ញុំចង់ធ្វើ
it will be a great thing for one to become a nurse, because when you care for a person who is very sick and gets better, there's a big reward for you. I encourage many more people to join nursing so that we can help our patients and they get better.
So the Kochon Prize this year, which, as you know, we are being able to give as a Stop TB partnership through the generosity of the Kochon Foundation, had as a theme excellency for this amazing category of professionals, the nurses. And I'm extremely grateful for the work that our 4 members of the panel put a lot of time in going over the scoring, over the nominations, over the scoring, and have calls to get together in aligning their scoring. And I just want to say that I'm extremely grateful to Ken Castro, Mel Spiegelman, Timur Abdullayev, and Paola Fujiwara that are part of this committee, and to my colleague Kiva in the Secretariat for handling this, that we are able to really run this process and to be able to award the Kochon Prize. Chairman Kim sent us a little video, and I would like my colleague Stefano to play the video of Chairman Kim, and then we go to our winners.
Good afternoon, ladies and gentlemen. On behalf of the Kochon Foundation, it's my honor to be with you at the 33rd Stop TB Partnership Board meeting. Firstly, I would like to thank Dr. Ruchika and Dr. Safu and all of you for providing us with a space in your important and busy agenda to celebrate outstanding achievements in TB. As chairman of the Kochon Foundation, I'm very proud of the long-standing collaboration with the Stop TB Partnership, which began in 2006. This year marks the 15th year of the Kochon Prize, a prize that we award annually to individuals and organizations that make significant contributions to combating TB, of which there are many. For those of you who don't know the Kochon Prize, it was established in honor of the late Chairman Jong-gun Lee, founder of the Jong-gun Dang Pharmaceutical Corporation and the Kochon Foundation in Korea, who was committed throughout his career to improving access to low-cost, life-saving antibiotics and anti-TB drugs. So this prize is very important to us. As we know, it is for the TB community too. This year to honor the hard work, devotion, and efforts of nurses and mark International Year of the Nurse and the Midwife, the Kochon Prize 2020 recognized exceptional nurses and nurse organizations who are on the front line fighting TB. Nurses in all our countries around the world are heart and soul health systems. We all witnessed this in all our countries in 2020 with the COVID-19 response. As such, this year to honor the work of TB nurses as caregivers, counselors, researchers, innovators, and advocates, we felt compelled to dedicate this year's Kochon Prize to TB nurses. As always, I would like to take this opportunity to sincerely thank the selection committee for their work in selecting the Kochon Prize 2020 winners. I know how hard and dedicated they are to the process and selecting the right winners. This year, I understand that it was not an easy job with the number of caliber of the nominations. So I would also like to thank all of those who submitted the nominations for those they felt were deserving of the Cotton Prize 2020. With that, I would now like to hand over the announcement of this year's winner to my friend, Dr. Ruchika Ditiu. Thank you very much.
Thank you, Chairman Kim. There were a lot of nominations, but the winners of this prize, because they will be to actually, in a way, I don't know how to say, impressed almost to tears the members of the selection committee with their work. I see Ken's image here and I see him smiling. They are not, junior, easy to impress colleagues in this committee, and to see them very touched by the work of the winners, it's really moving. And the winner of Kochon Prize this year goes first and foremost to RIAPED. RIAPED is an association of DR Congolese nurses. They support children with TB, primarily children with TB of the spine who are also stricken by poverty. And what impressed all of us extremely is the generosity of these nurses, is the hard work done, but also the fact that from the very little that they get, they put part of their own salaries to ensure that children are not only cured, but that they also can walk again with rehabilitation, nutritional and social support. They really contribute this from their own pockets. They were nominated by our friends from the Action Damien in DR Congo, especially Tina de Melener, that is a friend from a previous life that I had. But I want now to give the floor to Constant Bouchiri, nurse, founder and leader of RIAPED. We have recorded, I think, from Constant in French. So we also offer you free French lessons now for the next 2 minutes or so. So Stefano, if you can play the speech from Constant, please.
Dr Lucika Ditiu, directrice exécutive du partenariat Halte à la tuberculose, et M. Kim, président de la Fondation Kokan. C'est avec une grande émotion et satisfaction que nous avons été informés de la nouvelle du choix de notre petite Asbel RIAPED comme lauréat du prix Kokan 2020. L'émotion est grande car ce prix vient couronner les efforts d'une petite association créée sur l'initiative des infirmiers en 2009 à partir du constat fait par eux qui sont en première ligne de combat et qui restent plus longtemps au contact des patients et leurs familles pendant la prise en charge jusqu'à leur insertion sociale. Les constats faits par nous, infirmiers et infirmières, était que plusieurs enfants affectés de la tuberculose non secourus couraient le danger de rester infirmes toute leur vie et rater la scolarisation, situation qui les enfermerait dans un cycle de pauvreté. L'octroi du prix Kokan 2020 au RIAPED, 10 ans après sa création, constitue pour nous à la fois un signe de reconnaissance des efforts du réseau des infirmiers impliqués dans cette lutte, mais aussi une motivation qui nous donnera des ailes pour voler encore plus haut au secours des bénéficiaires de nos projets. Le RIAPED est une association qui soutient des personnes démunies affectées par la tuberculose et la lèpre en assurant les soins holistiques, car certains besoins n'étant pas couverts par les 2 programmes de Ligue et les ONG partenaires, nous faisons cela pas pour en devenir riches. Au contraire, c'est un volontariat, un travail en plus de notre activité professionnelle qui est en partie rendu possible par l'argent que nous cotisons de nos propres salaires. Notre association appuie chaque année 2 projets pilotes soutenus jusque-là par les fonds propres issus des cotisations des membres et par nos 2 partenaires privilégiés, je cite la Fondation Roi Baudouin et Action Damien. Une satisfaction parce que ce prix nous permettra de booster nos activités car certains de nos projets sont restés jusque-là sans financement. Il s'agit de l'extension de nos activités dans les autres provinces endémiques. 2. La culture de soya pour enrichir la bouillie que nous donnons aux enfants tuberculeux mal nourris en traitement. 3. Acquérir un terrain pour la construction d'un centre de santé pour la prise en charge des personnes très démunies dans les milieux les plus pauvres et périphériques de Kinshasa. Voilà pourquoi nous saisissons cette occasion pour remercier M. Kairman Kim de Kokan Fondation et Dr. Lucika, directrice exécutive du Stop Partnership, les membres du comité de sélection, toute l'équipe Action d'Amiens Bruxelles, toute l'équipe Action d'Amiens RD Congo et particulièrement Bernard Dikou pour organiser nos services de finances. Paix à son âme. La Fondation Roi Baudouin Belgique, qui soutient au moins 70% de nos projets dans la province de Kinshasa et du Kwilu, tous les amis du caucus belge qui nous soutiennent matériellement et moralement, tous nos collègues membres de l'IAPED qui ont donné le meilleur d'eux-mêmes pour que nous méritions ce prix. Et enfin, ma famille pour l'amour, le soutien et l'encouragement. Je vous remercie.
I want to thank very much to Constant for this speech. Because this was, we decided very recently, we didn't put the translation. We encourage people to learn French with this occasion. But I also want to say that what Constant basically said was, in addition to graciously thanking his family and all of us here, he emphasized how important it is to get this prize, to make them able to work, to continue their work on TB and leprosy happening in the peripheries of Kinshasa. I reinforce that they started the work in 2009 and they contribute a little bit of their salary to be able to do this work. So the Cochon Prize that is going fully to them for the period of 2020 will take them to be able to expand their activities. And I'm very honored that with this occasion, through this kind of movements, we are able to meet the people that we need to support. And I see you, Constant, there with your colleagues, and I'm honored to meet you. And I really promise that we stay in touch and continue this, because to be honest, you should lead us here. You are the ones struggling in the field in doing the work and helping everybody there. So, but what we did is because we have so many nominations and our committee loved so much everyone basically, we did what we are very good at doing at Stop TB, putting every penny left. So because there is no travel for Cochon this year, we said we create an additional award, a part of Cochon award, but we give as well to a second winner a smaller amount of funds, the one that remained, because we are not going anywhere this year, and that is going to Hiwot Membere. Sister Membere is from Bishoftu General Hospital in Ethiopia, and she has contributed to the response to TB and NDR-TB patients in Ethiopia. Single-handed, she led and established an NDR-TB treatment center in the hospital back in 2013, trained her fellow nurses to run the treatment center with high standards for nursing in such a way that the NDR-TB care center that she was running was nominated by the National TB Program to be a referral MDR-TB center in Ethiopia. And, that's why, her dedication to people with TB, as well as to supporting her fellow nurses, is exceptional, is inspirational. She was nominated by Dr. Kumsa, who is an advisor for NDR-TB in the Ministry of Health of Ethiopia. And I think we have a very brief video from Sister Membere, please.
Dear Dr. Lucika Aditya, Executive Director of the Stop TB Partnership, dear Chairman of the Cochon Foundation, dear the Cochon Prize 2020 Selection Committee, fellow TB and TB nurses in Ethiopia and all over the world. Greeting from Ethiopia, the land of origins. I am deeply honored and highly grateful to be the recipient of Cochon Prize Award for the year 2020. This award and recognition is enormous for me as MDR-TB nurse. In 2010, I was called to serve as a founding nurse of the MDR-TB unit. The stigma and fear for MDR TB was very high. I was not really sure of any hopes of success as we received very sick patients with MDR TB. After receiving a different training on the clinical management of MDR TB, I came to believe that the disease is curable with appropriate care and treatments. I have developed a firm belief that with education and hard work we can improve. I have encouraged my team to provide the nursing care optimally for every patient besides ensuring adherence to treatment guidelines. I have voiced and advocated for the needs of MDR TB patients and affected families to diverse group of stakeholders. Shortly after our small MDR TB unit was upgraded to a standard MDR TB referral care center in 2014, we began to see improvement in the clinical condition of our patients. We cured many MDR and XDR TB patients and restored the hopes of affected patients and families. Let me tell you that it is not just my sole effort that has brought me here. I would like to make a special mention of my team and all Bishop Hospital staff, all TB partners and donors supporting TB, the National TB Control Program for their support. My special thank also goes to Dr. Andargacho Kumsa for nominating me for this award after looking into my contribution in advancing MDR TB nursing care over the years. I would like to thank the Stop TB Partnership, the Quantum Foundation and the Selection Committee for honoring our work. I believe that this award will help in sparking chain of positive reaction to ensure highest MDR TB nursing care standard in my country. Thank you for uplifting the roles of frontline TB MDR TB nurse. Thank you for your profound contribution in the fighting against TB. Thank you very much and God bless.
Thank you very much for this, and I really, it's different when you are in a real space because you can applaud and you can hear the energy. It's a bit difficult here when in front of a screen, you cannot really transmit the same, but I hope we all got inspired by the work of our colleagues, and I'm really grateful, as I say, that we had an opportunity to reward you, and I hope that through Pochon prizes and our prizes, other prizes, we are able to identify so many amazing human beings like you in both organizations and individuals in working for so much at the ground level. We created 2 years ago a prize that we gave at the union on the Stop TB Partnership Community Awards. And this year we became a bit much better organized. We want and we will continue with this type of awards in rewarding communities and civil society partners. In 2020, we wanted to reward especially overcoming the obstacles of the COVID pandemic to champion TB, and we managed to get, this is the Stop TB prize moving away from the Cochon one. We received close to 50 nominations covering global, regional, and local level. We are very grateful for the work of our colleagues from GCTA at global level, ACT and Draft TB at regional level, and TB Proof and the Water Youth Development Projects at country level who came very close. But the winners for these three categories with the Stop TB Partnership Awards, I would like to start with the winners at the national level, which is the Network of TB Champions in Kenya. They were nominated by Kelin, by African Coalition on TB and the Stop TB Partnership Kenya because of their work ensuring the voices and priorities of TB-affected communities informed and also really getting them extremely engaged in all the processes for the Global Fund funding, which we think is extremely crucial. So we have our Network of TB Champions from Kenya as one of the winners. For the regional work, we are very happy to see that the Americas TB Coalition that worked at regional level trying to do best rapid mobilization in rapid response to COVID COVID-19, documented impact of the pandemic, advocating through the development of continuity of TB care during COVID-19 pandemic in the Americas, a document in Spanish, and also continuing to engage with people, including virtual support, including virtual psychosocial support. And the group was nominated by Leo Leca from Peru, Ignacio and Pedro from PAHO, WHO, Fundación Anclac Colombia, and few others. So strong support for the winners of the regional from the Americas TB Coalition. And at global level, I think it's not a surprise. It's a coalition, so that's why it's very many partners. Is the TB COVID working group made up of Action Global Health Advocacy Partners, Results Canada, CANCO, Global TB Caucus, We Are TB, McGill International Center, Stop TB Community Delegation, Developing NGO Delegation of Stop TB Board, GCTA, TB PPM Learning Network, and We Are TB is the group that came together to really put the impressive document on the impact of COVID, conducting the survey, drafting a report, and launching the call to action under the COVID, on the TB impact of COVID on the TB response, a community perspective that we think is very. So we have a national, a regional, and the global winner of these prizes. The last group was nominated by our colleague Madhu Pai. I think with this, I want to congratulate all the winners of today. And I think we have a little video with some a 3 minutes video for 2 prize winners, I am told, being here. So let's go ahead with that. Thank you.
Last year, I saw Kaylin win the Cochrane Award for Human Rights. Kaylin, together with Stop TB Partnership Kenya, are 2 organizations in Kenya that have strengthened us, as well as ACT at a regional level, together with Stop TB global level, has given us support and given me personally support to realize that our dream of having a network of TB people is realized. TB not only being in existence in Kenya, but having the capacity to strengthen the national TB program. It is amazing that we are now recognized for our work that we do on the ground. Thank you very much, Idrin Kibuchi. Thank you very much, Alan Maleche, in particular for supporting us and making sure that this network is being very strengthened. We are a grassroots network of people affected by TB, where we are always included in the Nairobi strategy on human rights, capacity building. We also participate in the UNHLM priority setting. And this year, we combine the knowledge at the national level to ensure that we are inputting the priorities in the global fundraising request with just limited data. Because the meetings were virtually, we didn't get tired. We used our skills to ensure that our voices are well led. Finally, we would like to thank Stop TB Partnership Global for always setting up the bar of affected people and ensuring that the affected communities are well identified and are well realized in all levels. Thank you very much, Stop TB, and thank you very much, Kirin Kenya. This is really a great opportunity and a great honor to receive this award as a network of TB champions in Kenya. Thank you very much. This is Steve from Network of TB Champions Kenya. Thank you.
The TB COVID CSO and Affected Community Working Group is pleased to accept the 2020 Global Stop TB Affected Community Award.
We couldn't sit idly by while the pandemic devastated TB programs around the world.
We knew that now more than ever, we needed to pool our resources and that united, our voices could not go unheard.
On behalf of CANCO,
the Action Global Health Partnership,
the Global TB Caucus,
the TB PPM Learning Network,
McGill International TB Center,
the Stop TB Community and Developing Country NGO Delegations, the Global Coalition of TB Activists, We Are TB, TB People, and Results Canada, we graciously accept this award.
We are looking forward to continuing to work together with the support of this grant to take forward the calls to action from the findings of the Global Civil Society and Affected TB Communities-led survey.
So if you haven't already done so, go read our report, The Impact of COVID-19 on the TB Epidemic, a Community Perspective.
And you can take action alongside us by emailing tbcovidadvocates@gmail.com. Thank you.
Thank you.
Thank you.
Thank you.
Joanne, up to you, and thank you very much for this moment, and thank you.
So first, congratulations, thanks again to the Coachella Foundation, and congratulations to the incredible work of the frontline health workers who are awarded these prizes, and also to the critical advocates at country level and at global level coming together to, highlight the challenges that we're facing in this moment, and also drive the resources and the attention that we need. So in this next important session, we're going to go right into this next session on TB targets and commitments. We're going to have two presentations. First, Dr. Subhanan Sahu, the Deputy Executive Director of the partnership, is going to present on the UN high-level meeting targets and several very important Stop TB partnership and partner-led reports on monitoring progress made toward achieving the high-level meeting commitments. And then Dr. Teresa Kaseva is WHO's Director of the Global TB Program. She will present about the recent United Nations Secretary General's report. Following that, I'll open up the floor for discussion, and then we'll go back to Dr. Sahu for a presentation on the next global plan to end TB. And only to say, it's obviously critical that we are clear and understand the prior progress, but also the major gaps and the barriers for achieving these TB targets pre-COVID, and now the hugely harmful impacts of COVID and the fallout for the progress against those critical targets that mean lives.